Thank you, Lydia, and thank you for putting up with the slide challenges. We have an outstanding third member of this panel who was one of the founding, probably presenters at the initiation of the Health and Buildings Roundtable at that Green Building meeting way back. Dr. Judy Heerwagen is here from Washington State. She's with the General Services Administration, and she is their Sustainability and Green Building Advisor and has co-edited a really important book called Biophilic Design, which I've dipped into and want to read more. But Judy's going to talk to us more about the impact in an office building of improving design.
Thank you, Jane, and thank you to Charles Bloomberg, who is I've worked with for well on to 20 years to get something like this going. But I think we've got a movement, and it's going to take off, which is really exciting. I'm going to talk about interiors of buildings as a starting point for how we think about it. And I'm a ecologist at heart, a behavioral ecologist. I spent much of my graduate career studying birds, and I was well on to my way to be an ornithologist when I decided to say, hey, does some of this have something to say about people? So I began to sort of, how do we use the basic principles of ecology? How do we understand that and actually begin to use those ideas in design? And one of the examples I'm going to show of how I didn't do this, but this was basically looking at that idea. And for those of you who think your office is too much of a zoo, I challenge you, what happened to this? Huh? Push this? Okay, sorry. I think it's not enough of a zoo. If we look at this example on the left, this is how zoos used to be designed. Animals were in cages. They were meant to be seen by the people who came there. And what zoos did a really good job was keeping them alive. Animals survived in the zoo, but they didn't flourish. And zoos became very concerned about, believe it or not, the psychological and social well-being of their animals. They wanted to sort of have them be animals. So to look at, and what they did was brought together integrated teams of field zoologists, of botanists, of people geologists, of people who understood the habitat in which these animals lived. And what they tried to do was recreate the essential features of that habitat that would support psychosocial well-being. And the picture on the right is from the Woodland Park Zoo in Seattle, which is one of the leading zoos in the country for this kind of thinking. And there you see the giraffes are now in what is a savanna-like environment. They're with other animals. These are the animals that they usually hang out with in Africa, except for the lions, who are in another area of the zoo. So what they've done is really recreate this by looking at what the animals needed, how they behaved, where they ate. So they actually forage now out in this space, and they bring them in at night. But they're letting the animals live the way they should. And the animals are better, they're more healthy, they reproduce more, which is the essential characteristic of animal well-being and success. And they've also increased zoo attendance dramatically by this transformation in the zoo. And I want to look at an example of something similar to that. The one on the left is a building that probably looks kind of familiar to a lot of you in the federal government. If you open those doors, what you would see is rows and rows and rows of 6-foot gray panels. No view to the outdoors, nothing except panel after panel after panel of cubicles. This is the most common workspace in the federal government. All of these talks about how the workplace is transforming, you look through any federal building and you say, huh? We're not there yet. The building on the left is that office moved into the new Army Corps of Engineer building in Seattle. Just opened in February, was funded by ARA funds. And what they did was just totally transform this space. This doesn't do it justice, but it's very daylit. And what they have is an atrium in the middle that actually they tried to put a real stream in here, but they weren't able to do that, so they have a rock bed that looks like a stream. They have some trees and plants in here, and what they've done is create spaces that allow people to work in many, many different kinds of ways, and they had real trouble getting the Army Corps of Engineers to move out of those high cubes. They were terrified. They said they needed their privacy, they needed this, they needed that. We talked to them a lot about what evidence we know about, what happens when you move into a different kind of space. And we're going to be studying it as part of one of our projects. But they have low panels now. You can sit at your workspace and see everywhere in the building. See everything throughout the building. And if we look at this, how do we begin to pull out some general principles and ideas that we can use in our buildings and use this as an evidence? We've heard about evidence-based design here all day long. And I think that's it, taking what we know from the social sciences, taking what we know about zoos, and saying, can we actually begin to look at what are these principles that should be guiding us as we design? Sense of belonging in community is absolutely essential. We are social species. It is a basic and fundamental human need that is linked to health. Behavioral choice and control. Let people do what they want when they want to do it, not schedule them. Let them work in different places. Equitable access to nature. We all know the corner office is still highly valued. The corner office is valued because it gives greater views, greater access to the outdoors. It wouldn't be valued if it did not have a real psychological value at some point. Equitable access to health resources, I think, are real. Healthy food, exercise, a lot of what we've been talking about. I think these are the kinds of things that can become principles for how we approach design. I'm going to give one example very briefly of the Denver Federal Center in outside of Denver in Lakewood. It was a GSA project, and this was the Workplace 2020 project that was looking at how can we transform the environment to actually support organizational effectiveness and work effectiveness, both individually and collaboratively, of federal employees. This was published. This was an NIH group of researchers. Julian Thayer led the team. Esther Sternberg was also on the research team. And what they did was go in and look at workers in an old space that had not been renovated yet and in a new space that had much better access to views. It had the social features and so forth. And what they did was they got a group of people, 25, 30 in each space, and this was simultaneous, so it wasn't different times of the year or something. And what they looked at was perceived stress levels. They'd get a little beeper and they'd have to rate their stress level at the time of the beep. Continuous cardiac activity, they were looking at heart rate variability, which is a sign of a healthier heart. And they looked at salivary cortisol, measured it 4 times a day. The people wore the sensors 24 hours a day for 5 days. And they did the cortisol test for 5 days. This was the old space. Does this look familiar? This is their new space. It has a lot more daylight. The workstations are pulled away from the wall. Everybody can see out the windows. And it's a really different kind of environment than the previous one. The key differences then were these things: the equitable access to daylight and nature, improved access to social spaces. They had a fitness center, and just greater overall choices. There were no differences in HVAC or ceiling height. They used the environment it was. The major structure didn't change. Here are the results. They had significant main effects on cortisol and heart rate variability, which meant that those in the new space had a healthier heart rate pattern than those in the old space. They had lower cortisol than those in the old space. And the interesting thing was that these results actually were true at home also, at work and at home. It meant that as you were less stressed at work, it carried over into your home environment. So these are the kinds of results that we're looking for. They didn't find any differences in perceived stress. So there was something your conscious mind was not aware of what was happening to your body, which I think is really, really interesting, because we always depend on conscious, subjective responses rather than these physiological responses. So if we look at these kinds of things, are there similar results for other community outcomes? And I think we can say yes. We know that these things do matter. Lots of studies here, study of vitamin G, vitamin green in the Netherlands, which is looking at connection to natural outdoor spaces and the impacts on health. Numerous kinds of studies. Daylight also looking at the sleep patterns related to your daylight exposure. So I think that we do have evidence, and I think we need to accumulate more, but we have enough to act on. Thank you.